Before we dive into the groundbreaking details of the new 2-week radiotherapy treatment for prostate cancer, don't forget to hit the subscribe button and turn on notifications. Stay up to date with the latest advancements in healthcare, cancer treatments, and more. Welcome back to our channel, where today we're going to dive into a crucial topic: prostate cancer and the groundbreaking advancements in its treatment. Prostate cancer is one of the most common cancers affecting men worldwide. And for many years, treatment options for prostate cancer have remained largely the same. But now, thanks to a major breakthrough in radiotherapy, there's a new hope for patients that promises shorter treatment times and just as effective results. But before we get into that, let's first understand prostate cancer, what it is, how it develops, and why it's important to know about the new treatment advancements. What is prostate cancer? Prostate cancer begins in the prostate, a small gland that is part of the male reproductive system. The prostate produces the fluid that nourishes and transports sperm. It's located just below the bladder and in front of the rectum. Now, prostate cancer typically grows slowly and can sometimes be contained within the prostate. However, there are cases where the cancer can spread to other parts of the body, making early detection and treatment incredibly important. But how does prostate cancer develop? Well, the cells in the prostate start growing uncontrollably, forming tumors. These abnormal cells, over time, can invade nearby tissues or spread to other organs. Prostate cancer is often referred to as a silent killer because it doesn't always show symptoms in its early stages. The good news? With early screening and proper treatment, many men can live long and healthy lives after a prostate cancer diagnosis. Now let's talk about why some men get prostate cancer. While the exact cause is still not completely understood, there are several risk factors that may increase a person's chances of developing the disease. Age. As men get older, especially after the age of 50, the risk of prostate cancer increases significantly. Family history. If your father or brother had prostate cancer, your chances of developing it are higher. Race. Studies have shown that African American men are more likely to develop prostate cancer and at a younger age compared to other racial groups. Diet and lifestyle. Diets high in fat and low in fruits and vegetables may increase the risk, although this is still under research. Although these factors can increase your risk, it's important to remember that not all men with these risk factors will develop prostate cancer. And many men who develop prostate cancer have no obvious risk factors at all. The traditional treatment, radiotherapy. Once diagnosed, there are several treatment options for prostate cancer, and one of the most common treatments is radiotherapy or radiation therapy. Radiotherapy works by using high-energy rays to destroy cancer cells. It can be used in various stages of prostate cancer, including after surgery to target any remaining cancer cells or as a primary treatment for localized prostate cancer. In the past, radiotherapy for prostate cancer typically took 6 to 8 weeks, with patients visiting the hospital multiple times a week. While effective, this long treatment period had its drawbacks, such as patient inconvenience and strain on healthcare systems. A recent clinical trial has shown that a 2-week course of radiotherapy can be just as effective as the traditional 8-week course, offering similar survival rates and disease control with fewer side effects. This is huge. This new approach is called ultra-hypofractionated radiotherapy, and it involves delivering higher doses of radiation in fewer sessions. This not only shortens the treatment time, but also provides the same level of cancer control. This breakthrough is a game changer for prostate cancer patients. Shorter treatment means less disruption to their daily lives and potentially lower healthcare costs, without compromising on the effectiveness of the treatment. The Hypo-RTPC trial, a game changer. The clinical trial that tested this new 2-week course was called the Hypo-RTPC trial, which involved 1,200 men with intermediate to high-risk prostate cancer. Participants were randomly assigned to one of two groups. The short course group, which received 42.7 gray of radiation over 7 sessions in 2.5 weeks. The standard course group, which received 78 gray of radiation over 39 sessions in 8 weeks. The results were promising. After 10 years of follow-up, both groups showed similar disease control and survival rates. This means that the 2-week course worked just as well as the traditional 8-week course. Patients in both groups had a 4% prostate cancer-specific mortality rate and high rates of failure-free survival. Why this new treatment is important? This new shorter course of treatment is important for several reasons. Less disruption to patients' lives. Patients can complete their treatment in a fraction of the time, which means less time off work and fewer hospital visits. This is crucial for men who want to maintain their daily routines. Lower healthcare costs. By reducing the number of treatment sessions, the overall cost of care is lowered. This could make prostate cancer treatment more accessible to more men, especially in low-resource settings. Improved quality of life. With fewer sessions and a shorter treatment time, the overall burden on patients is significantly reduced, allowing them to focus on recovery and their well-being. The future of prostate cancer treatment. As more and more studies confirm the effectiveness of ultra-hypofractionated radiotherapy, it's likely that this approach will become the standard for treating localized prostate cancer. It's important to stay updated on the latest research and treatment options so that patients and healthcare providers can make the most informed decisions. As we move forward, it's clear that personalized treatment will play a big role in prostate cancer care. With advancements like this, patients can look forward to shorter, more effective treatments and a higher chance of living a long, healthy life after diagnosis. To wrap things up, prostate cancer is a serious condition, but it's also one that's very treatable, especially with early detection. With the development of shorter, more effective treatments like 2-week radiotherapy, men now have more options and a greater chance of a successful recovery. If you or someone you know has been diagnosed with prostate cancer, speak with your doctor about the treatment options that may be best for you. The future of prostate cancer treatment is brighter than ever, and advancements like these are helping to make it easier for patients to get the care they need without compromising their quality of life. Thank you for watching, and don't forget to like, share, and subscribe for more updates on the latest cancer treatments and health tips.